Hello, everyone. Thank you for joining me. My name is Nikki Young. I'm a financial advisor with Northwest Financial Advisors. We are a wholly owned subsidiary of Northwest Federal Credit Union. I want to welcome you to today's presentation of Planning for Healthcare Costs in Retirement. A few compliance items before we begin. I want to be clear that this presentation is general in nature and may not address every single healthcare topic. It is not intended to be a substitute for individualized advice. For inquiries specific to your unique situation, it is recommended to consult with a financial advisor, or after the webinar, you'll have an opportunity to request a personal consultation. So here's the agenda on what we're going to be discussing. First, we'll start with the healthcare cost outlook, which is data surrounding not only the current state of healthcare costs, but where we're headed in terms of future costs. Then I will spend some time reviewing the ABCs of Medicare and what options you have there. And the reason that's important to discuss is because Medicare is really our first line of defense in managing our healthcare expenses. Then we'll take a look at some planning considerations for costs. What factors and scenarios should we have top of mind, and some best practices on how to develop the best plan financially to cover those costs. Lastly, before wrapping up, I do want to touch on long-term care, which has more and more people concerned, and rightfully so. Long-term care can be a huge expense in your later years and presents a far different type of retirement planning challenge than annual healthcare costs. So let's get started with the outlook on healthcare costs. So although healthcare tends to be the second largest expense in retirement behind housing, it's also the biggest expense that individuals don't necessarily plan for. There was a study done by Fidelity in 2022 that estimated that the average 65-year-old retired couple can expect to spend around $315,000 on healthcare costs in retirement. For single men, that number is about $150,000, and for single women, it's about a little over $165,000. That can be attributed to the fact that women tend to have higher medical costs than men and generally live longer. Now, this number doesn't include the cost of most dental services, over-the-counter medications, and long-term care. So depending on the care that you need, you may have higher costs than what that figure states. In terms of future costs, healthcare costs have been increasing at about 1.5 to 2 times the rate of inflation. And that's something that we feel whether we are employed or retired. Your healthcare premiums with your employer might increase, as well as your out-of-pocket costs. And then on top of that, we consume more health services each year as we age. So if you're not a 65-year-old retired couple today, and maybe you're a few years out from your retirement or even your your Medicare eligibility, it's safe to assume that you're probably going to have higher costs. And those higher costs, if you don't have a plan for them, could put you at a risk of outliving your savings. A plan that should include knowing what your cost estimates look like, how you're going to pay for that, what Medicare covers and does not cover, and how all of that impacts your retirement decisions. So now that we have an idea of the potential costs of healthcare and retirement, I do want to do an overview of the different parts of Medicare, or the ABCs of Medicare, they're often referred to, what they cover in general, and the premiums for each part. Medicare, as we know it, is our federal health insurance program for people age 65 or older. It also covers some individuals with certain disabilities. And it is one of the greatest assets that we have as retirees because it's a key way in which we pay for our medical care. A lot of people just assume that Medicare is going to cover or pay for all of their care, but that's simply not the case. In reality, Medicare only covers about 2/3 of our costs, and it's helpful to know what your options are there. So when you become eligible for Medicare, you have something that's called the initial enrollment period. And that is going to include the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months that follow your 65th birthday. So that is the time period that you have to enroll into Medicare. And when you do that, the first part that you're enrolling in is Part A, which is the hospital insurance. So that's going to cover most of the stays in a hospital, as well as some follow-up expenses that you may have after you've spent time in a hospital, such as a period in rehabilitation or a skilled nursing home care, or even hospice care. In most cases, you do not have to pay a premium for Medicare Part A, which is why sometimes people will say, well, there's a part of Medicare that's free. Typically what they're referring to is Part A. There's no premium for that, and that's because we have paid into the Medicare system via our payroll taxes. So when you look at your pay stub and you see that deduction for Medicare, that's what it's going into. And as long as you've been doing that for 10 years of employment, you don't pay a premium. But what you do pay are out-of-pocket costs in the form of deductibles, co-insurance, and co-pays. The deductible for Medicare Part A is $1,600 per benefit period. Your benefit period starts once you're admitted into the hospital. Now, that deductible may decrease or go away altogether if you have supplemental insurance, which I will review in a later slide, but $1,600 is the standard deductible for Part A, and what that means is once you're admitted into the hospital, that first $1,600 of costs are going to be your responsibility before the insurance starts to pay a benefit. Other limitations that are important to note is that you have 90 inpatient days per benefit period, so 90 days that you can stay in the hospital. Each of those days is going to have its own different cost depending on the length of your stay, as well as we have 60 lifetime reserve days. And so if you need to stay longer in the hospital than your 90 days, well, then you can use your 60 lifetime reserve days in order to extend your stay. Each of those days does have its own cost. And those days are not renewable. So if you end up using one of those days, that's going to decrease the amount of days that you have remaining for your lifetime. Also important to note that Part A does cover 100 days in a nursing facility. The other part that you enroll in is Part B, which is our Medicare medical coverage. So that's going to cover doctor's visits, preventative care, outpatient care, and other medical services. Out-of-pocket costs are a little bit different for Part B, whereas you do pay a monthly premium in addition to your deductibles, co-pays, and co-insurance. In 2023, these base premium for Medicare Part B is $164.90. That premium could be higher depending on your income. And then there's a Part B penalty, and I'll get into that a little bit more. Part B is optional. So when you first enroll, become eligible for Medicare, you get Part A, and then you can decide whether you want to enroll in Part B. But if you delay, meaning you don't sign up during that initial enrollment period and maybe a year or two later you decide that you're going to go back and pick up that coverage, you are going to pay a penalty. And that penalty is 10% of whatever the premium is at that time. And so you will pay that premium as long as you have, you will pay that penalty as long as you have Part B coverage. So that's going to add up to a significant amount over the course of your retirement. So it's a best practice to know if you're going to pick Part B up once you become eligible for Medicare, and be intentional about signing up during your initial enrollment period. I'm going to go a little bit out of order here and skip to Part D coverage, which is coverage for prescription drugs, both brand name and generic. You are not automatically enrolled in Part D. You do need to sign up. These plans are provided by private insurance companies, and the out-of-pocket costs are very similar to your out-of-pocket costs for Part B. So you have your monthly premiums, deductibles, co-insurance, and co-pays. The premium is going to vary depending on which plan you decide to enroll in, but on average, the cost for Part D is about $31.50 a month. That premium could be higher depending on your income. And there is a Part D penalty as well, where if you delay enrollment and decide to get it later, you'll pay a penalty. But I do know that the penalty is much less than what it is for your Part B. Now, there is a Part C to Medicare that's known as Medicare Advantage. These are offered by private insurance companies, and it's a private alternative to having Parts A, B, and D individually. You may have seen the commercials advertising Medicare Advantage. Some of them have, seen one with George Foreman in it and Joe Namath in it. And what Part C does is it bundles Parts A, B, and D together. And then the plan may be customizable, so you might be able to add some optional benefits. And what I would say is just understand the different types of plans, and there's a bunch of Medicare Advantage plans on the market right now. And you still, even if you decide to bundle, you still have to pay your Part B premium. But because of that, your premium for Part C sometimes is extremely low, or you don't have to pay a premium for Part C at all. But there is always a trade-off. And the trade-off with Medicare Advantage is that they often have network limitations in terms of the providers that you can see, how you can see a specialist. Now, there are some great advantages to Medicare Advantage. All of your care is coordinated under the same umbrella, but if you have preferences on the type of provider or the doctor that you want to see, you want to make sure that that provider is within the network before you decide to enroll in that plan. And the costs and the premiums is just going to vary depending on what insurance company you decide to work with, which plan you select, and any of the optional benefits that you may add to Medicare Advantage. And then right underneath there, we have Medicare supplemental insurance, which is also known as Medigap insurance. And as opposed to being a bundle, you still are going to have your Parts A, B, and D individually, but then you're going to have your Medigap plan that, as the name suggests, is designed to supplement or fill in the gaps of what your individual Medicare parts don't cover. There is a monthly premium for Medigap, but you do have a lot of flexibilities to see a provider that all the requirement is that they accept Medicare. Now, the Medigap insurance also, it's important to note that they may cover a cost of your, a portion of your co-insurance or your co-pays. So the takeaway here is that carefully consider your Medicare enrollment options. Revisit them annually. Decisions and how you set up your plan is going to depend on your personal needs, your circumstances, including the trade-off between what are you going to pay in premiums and your out-of-pocket expenses. Now let's review some of the key items to consider for planning. The first is coordinating retirement, Social Security, and Medicare. Unless you're a federal employee and you have and you're eligible for federal health benefits, or you have an employer where your insurance will follow you into retirement, for most of us, you cannot take your health insurance with you when you retire. This, a group that comes to mind when I think about that is those that have generous employer health benefits. Once you retire and you're no longer receiving that, more of that responsibility for covering your healthcare costs is on you. And so it's important to understand what that means for when you retire, your retirement age. The average retirement age is 63. You're not eligible for Medicare until 65. So what are you going to do? What is your strategy going to be to bridge the gap in healthcare coverage between when you retire and age 65? You're either going to have spousal benefits. If your spouse is still employed, you can get picked up on their health coverage, or you can enroll in a plan through the health insurance marketplace. I'm not familiar with the plans on the marketplace, but what I do know is that the premiums are much more than what Medicare costs. So that's something to be aware of, is that your cost may be elevated for that period of time if you're going to enroll in a plan through the health insurance marketplace. If you're already receiving Social Security when you become eligible for Medicare, you are going to be automatically enrolled. Social Security will automatically send you the paperwork to get you enrolled during that initial enrollment period. And conveniently, you can have your Part B premiums deducted from your Social Security payment. So it makes it pretty easy there. If you're not yet receiving Social Security and you want to enroll in Medicare, you can go ahead and do that. You'll just need to make other payment arrangements up until you begin receiving your Social Security. If you are covered through the federal employee health benefits, meaning you are going to have health coverage through the federal government after you separate from service. When you turn 65, even if you're still working, enroll in Part A. It's premium free and it'll pay second to your federal health benefits. And it's something that you've paid into. It's an earned benefit and there's no harm in taking advantage of it. So for the most part, it's recommended that even if you're working, once you become eligible for Medicare, go ahead and enroll in Part A. For most people, if you're still working, it makes sense to delay Part B because there's a premium for Part B and you're going to end up paying two premiums, one of which might be higher depending on your income. So in general, if you're still working, go ahead and delay Part B. When you separate from service, that is when a decision is going to need to be made. You are not required to have Part B, but again, if you decide that you don't want it and you delay and then you enroll later, you'll face the 10% penalty. If you do enroll in Part B, then you'll be paying two premiums and your premium could be higher depending on income, but you will likely have 100% coverage on all care. So this is a decision that's going to require a little bit more thought and calculations based off of what coverage is important to you, your income, and the cost sharing options between Medicare and federal health benefits. There's no need for Part D. When you have federal health benefits, it's not necessary to enroll in Medicare Part D. Prescription drugs is already covered under the federal health benefits, so it wouldn't be beneficial for you to enroll in Part D. Okay. So throughout the presentation, I have mentioned and referenced that your premiums could be higher based on income. This higher amount that you would have to pay for Part B and Part D is called your income-related monthly adjustment amount, or your IRMAA, as it's known as. And this is based on your modified adjusted gross income and includes all income that you have that is subject to tax. So that's going to be your pensions and Social Security, your required minimum distributions. And if you're thinking of doing a Roth conversion or a sale of highly appreciated stock in a given year, that needs to be carefully coordinated with the rest of your income so you can be aware of any impact as it relates to your IRMAA. So here are the IRMAA brackets for 2023. The first thing that I'll point out is that the 2023 IRMAA brackets are based on 2021 income. And so IRMAA is based on income from 2 years prior. So 2021 income for 2023, 2022 income for 2024. And I believe that's just because in the short term, people file amendments to their returns. So they want to be further out than just prior year information to eliminate errors and adjustments. Now, if you look at the starting premium for Part B at $164.90 compared to the highest premium, those differences are pretty steep. So the starting premium is if you're single with a modified adjusted gross income of $97,000 or less. If you're married, it's $194,000 or less. You're going to pay that standard premium for Part B, and then it will go up from there. I worked with a couple who separated from federal service. They had their pension income, and while they were employed, they had a business, but they didn't put that much energy into it. And one of their goals was once they retired, they were going to put more energy into this business. And it ended up being a lot more successful than they had imagined. And by the time they went to sign up for Medicare, they were going to have to pay over $500 each for Part B if they wanted to pick it up, which they were considering for personal reasons. And so then it's, how do we take steps to reduce our taxable income? We have Social Security on the way, and our RMDs are on the way. All of these things that are going to bump our income up. So that's really a planning conversation that we have. And the reason why I bring that up is because, you know, in my engagements with clients and my observation of just society, 65 today is not what 65 looked like in 1940 and 1950. People are still relatively healthy. They have desires to continue to work. And so we often think about retirement in terms of what are we retiring from? But I think it's going to be helpful to keep in mind, what are we retiring to? Especially from an employment standpoint, if that's something that we have, we want to continue doing in retirement, and how all of that may impact us financially with things like our IRMAA. Moving on to health savings accounts. Health savings accounts, they are a particularly powerful way to save for medical expenses. And what makes them so powerful is that they have triple tax advantages. So when you contribute to a health savings account, your contributions are tax deductible. And within the account, you're able to invest it to help those monies grow. That growth is going to be on a tax deferred basis. And then when you distribute those funds or withdraw those funds for qualified medical expenses, that those withdrawals are going to be tax free. You can use an HSA to pay for eligible expenses, including long-term care and insurance premiums. Now, you do have to have a high deductible health plan in order to enroll in an HSA or an HSA eligible health plan. But if you do, it can be a great tool to save for medical expenses. One thing to keep in mind is once you enroll in Medicare, you can no longer contribute to your HSA, but you can use those funds to cover most of your out-of-pocket medical expenses. And also, once you reach age 65, withdrawals from an HSA can be used for any purpose without penalty, but you will have to pay some ordinary taxes on any of the funds that are not used for medical expenses. The contribution limits for 2023 to an HSA are $38.50 for self and $77.50 for family. And lastly, I want to talk about our retirement accounts that most of us have if we're employed: TSP, 401k, 403b, IRA. If you are intending to use a portion of your retirement portfolio dedicated to covering your healthcare costs, it's a good idea to know what the savings rate needs to be in order to put you in the best position to be successful with that. You want to make sure that you are saving enough not only to continue with your standard of living that you would like to have in retirement, and include those healthcare costs as well. Now, I just want to review long-term care needs and costs. Long-term care, as I mentioned, does present a far different type of retirement planning challenge than our standard annual healthcare costs, and it is concerning because these costs can be predictable. Sometimes there is none, sometimes they're large costs, and long-term care expenses are rarely covered by our standard health insurance policies unless you have a long-term care policy. It is estimated that 70% of people reaching age 65 are likely to need some form of long-term care during their lives. And so the total amount that you may need is going to depend on whether a long-term care event happens or not, what type of care you need, and for how long. You're either going to have no costs, or because a long-term care event does not occur, modest costs due to a temporary event, or prolonged costs where extended long-term care is needed. Now, a long-term care event is triggered by individuals needing assistance with 2 or more activities of daily living. That's bathing, dressing, toileting, transferring, eating, or someone maybe with a severe cognitive impairment who requires substantial supervision for safety reasons. Now, I have here annual costs for Virginia, because your costs will vary depending on your geographic location. So if you need assisted living, it's about $20,000 to $63,000. In-home care is about $60,000 annually, and then nursing home care starts at $109,000 plus. As we know, nursing homes are more expensive type of care to receive. So can we predict if we will have a long-term care event? No, but there are factors that are directly related to the need. First is age. The older you are, the more likely you're going to need care at some point. Another factor is gender. There's an interesting stat that nearly 6 in 10 men can expect not to need care at all, while more than half of women can expect to use it. And this can be, it's not because men are healthier, but it's largely because of differences in gender with life expectancy. For example, if you have a couple where the male is older or is in poor health and needs care, more than almost 70% of the time, that care is given informally by the spouse, unpaid, and then the remaining spouse will go on to need whatever care they need. So that's why generally more men don't end up needing care. Your health status and your family history is going to be another factor. So even if the probability of needing long-term care is relatively low, the magnitude when it does happen is hard to ignore. So here are some sources of funding for long-term care costs. These include long-term care insurance. The long-term care market has evolved significantly over the years. They're still pricey, but there's been a shift away from traditional use it or lose it policies to more modernized hybrid policies that work like whole life insurance, where there's a long-term care component to it. If you use it, great. If you don't, what'll end up happening is a death benefit will be paid to your beneficiaries, which allows you to recover some of those premium dollars. There's HSAs, which we discussed, but the biggest source of long-term care funding is private out-of-pocket spending. It's best to explicitly plan should the need arise because of that. I've seen clients earmark guaranteed income or assets as their long-term care plan. And when you do that, let's say, for example, you have decided that your home is going to be your long-term care plan. You go into a nursing home, maybe you don't need the housing needs anymore. You can go ahead and sell your home to cover those costs. Then that can provide a peace of mind that your other assets are protected from these costs, and you can go on spending your portfolio as needed, and it can be whatever's remaining can be available for your legacy needs if that's a part of your goals as well. Important to note that Medicare does cover the first 100 days of long-term care or nursing home care. In closing, I want to share a little bit more about Northwest Financial, how we work with clients. This presentation covered your healthcare costs and your options and how that relates to your retirement plan. However, this is just one aspect of your holistic financial plan. As a client, we have thoughtful evaluation and discussion on all of the aspects you see here that make up your financial life. From a health cost perspective, we work with our clients in estimating potential healthcare costs, In no way are we medical professionals giving medical advice or even know every single nuanced thing about Medicare or long-term care, but we can look at the options available to you and provide some direction and guidance as to how it fits within your specific financial plan. Evaluating your retirement income needs. At the beginning of the presentation, I shared a stat about the lump sum cost of healthcare, and it was $315,000, and that can be an overwhelming number to try to plan for, but I believe it's more useful to focus on breaking that lump sum down and framing it in terms of annual costs. That way, that's something that we can plan for. It may vary from year over year, but it tends to follow a fairly predictable pattern over time. Then we can determine and plan for your annual income needs that already have those costs factored in. So by looking at your entire financial picture, we are able to provide comprehensive wealth management solutions to help you accumulate, preserve, and protect your assets, with the goal being to put you in the best position to have a successful, secure retirement, however that's defined for you. So that is going to conclude today's presentation. Again, I want to thank you for joining me. You will receive an email survey. Any feedback that you can provide is greatly appreciated. You will also be able to request a complimentary consultation via the survey. We at Northwest Financial Advisors would be happy to help you with your healthcare, retirement, and financial planning decisions, which is a significant part of your holistic health financial plan. Have a great rest of your day. Thank you.